Earlier, Dr. Patrick Amoth, the Director General acting at the Ministry of Health, is on standby to speak to us. Let's cross over now to Afia House. And Dr. I trust you can hear me loud and clear. First question to you is this. Is Kenya ready for a coronavirus outbreak? And I'm looking for a yes or no answer, Dr.
Yes, Wahiga.
Yes, Kenya is ready.
Yes.
Briefly, can you quantify that answer?
Kenya is ready because we have enhanced our surveillance systems at our ports of entry. We have a multi-agency approach, a one government, a one society approach to be able to discuss technical issues and issues that require policy directions. We have in-country capacity to be able to diagnose COVID-19 in 2 laboratories,
okay,
the National Influenza Center and Cambridge Laboratories. And we have also trained our human resource for health to be able to manage the condition as when it is diagnosed.
Let me actually stop you there. So how many have you trained? We're looking for specifics.
We have
here.
trained more than 1,000 healthcare workers, and this is an ongoing program. Our target is to train 5,000 healthcare workers. But remember, the healthcare workers are the same ones who are offering services. Mm-hmm. So the training must be staggered to ensure that services continue.
Okay. This coming Friday, according to President Uhuru Kenyatta's directive, the isolation wing at the Mbagathi Hospital should be ready. As of Tuesday evening, right now, what is the status of that isolation wing and the 120-bed capacity that was announced?
As of today, we have extended the bed capacity to 50 beds, which can be fully utilized. And we are on track to be able to achieve the target of 120 beds by Friday, as directed by His Excellency the President.
Okay. You said you extended...
We are taking all the...
Sorry, go ahead. Go ahead.
We are taking this matter very seriously to ensure that we have isolation capacity ready for any cases that we may have to deal with.
Okay. You said you've extended the capacity by 50 beds. Is that in addition? That you mean in addition to the 120?
No, out of the 120, as of today, we have 50 beds ready.
Okay.
And we are on track to be able to achieve the target of 120 by Friday, as directed by the President.
Tell me this, why 120? Did you do a survey as to the possibility of the spread of the outbreak and find that 120 is the appropriate number for Nairobi County, for example? Why 120? Why not 500?
120 is just because the capacity of that facility is 120 beds.
Okay.
But we have gone ahead to be able to map other facilities, including Kenyatta University Teaching and Referral Hospital, to be able to provide us with redundant capacity of 600 beds if that need arises.
Okay, so you have a fallback plan in case the 120 beds are full at the Mbagathi Hospital, then KU and other facilities could...
Yes, and in addition to that, of course, we have the level 5, the 12 level 5 facilities spread throughout the country. And we are in the discussion with the Council of Governors. Tomorrow we are having a meeting with the governors to be able to secure additional isolation capacities and 12 level 5 facilities, including faith-based and private hospitals.
Okay, I'm sure that's reassuring to those who are listening. So tell me this, as of now, how many suspected cases as a ministry are you currently monitoring, whether in Nairobi or other parts of the country? Suspected cases of the coronavirus.
As of today, we are only monitoring one case in Nairobi.
Okay.
But we have responded to 21 alerts involving 25 cases, all which turned negative for COVID-19.
The one case we assume is at Kenyatta. What about the case we are hearing about in Mombasa?
The case that was in Mombasa did not meet the case definition criteria and was flagged off. Okay, so we can assume no worries there. You're still monitoring that one case here in Nairobi? In Nairobi at the IDU in Kenyatta National Hospital.
Okay.
That is the infectious diseases unit.
And when can we expect you to give us a further update on that? How long will it take?
We expect to be able to get the lab results by about 2 a.m., 3 a.m. Kenyan time.
All right. One or two last questions for you. We've seen a video circulating online, and it's rather concerning. It shows a crowd bullying two Asian nationals somewhere here in Nairobi. As your committee looks at ways to deal with the coronavirus outbreak, organizations like the World Health Organization are saying stigma, rumors, and issues like that are also causing issues across the world. Is your committee looking at ways to address that and to ensure that people are not innocently bullied or harassed because of the coronavirus outbreak?
Yes, our committee is seriously looking at this issue. Racial profiling, stigma, and of course fear. These are the real dangers that we face as we try to combat COVID-19. And you remember during the press conference on Sunday, our Cabinet Secretary, Honorable Mutai Kagwe, clearly articulated this issue, that we should not be able to profile particular communities. For your information, most of the cases in Africa have not come from the Asian continent. Most of the cases that have been reported in Africa have come from Europe, specifically Italy.
Okay. And it was important for Kenyans to know that a journalist will always say last question. This is my last question to you. Some say the reason for the rumors and the stigma is because of lack of awareness by Kenyans. Yesterday, Citizen TV went out there to ask Kenyans if they know anything about the coronavirus. Some of them said they have no idea. My last question to you is there a budget? Are there provisions for public education, civic education, in markets, in schools, at bus stops? How do you respond to that?
We have an entire contingency plan which addresses all the facets of pandemic preparedness, including risk communication to the public, to the health workers, to everybody in general. And we have developed a framework out of that. We have started rolling out the messages. It may have not reached all the corners of the country.
Yes, I haven't seen them.
But we are on progress. We are on progress. Very soon you'll be able to see them.
Okay. I hope soon is tomorrow, Dr. Amoth. Thank you so much for speaking to us. Dr. Patrick Amoth, the Acting Director General, Ministry of Health, speaking to us live from his office at Afia